and welcome to another episode of Fun Facts at the Pharmacy. I'm your host, Dr. Christopher Greider. If you've never watched this show before, I'm actually a pharmacist located here in Northeast Ohio that works for Mark's Pharmacy. The purpose of this show is to kind of give you guys some general information to help make good health decisions and to make sure that you're kind of aware of a lot of different health disease, what's going on in the current news right now, just to make sure that it's all up to date for you. So to kind of start things off, we have a beginning segment called Fast Acting. We kind of hit some of the more recent events that are going on in the local area. The biggest one is, if you've ever watched any of the episodes in the past, we are big promoters of vaccination. It's one of the best ways to prevent a lot of major diseases and a lot of problems from occurring for anyone from very young ages to the elderly. The biggest thing right now is, if you're not aware of it, there is a current case of measles that has been diagnosed over in Stark County. So if you're not sure where Stark County is, it is a little bit further south, maybe about 20-30 minutes south from here in Hudson, but it's located over in the Alliance area. The reason this is a concern is because measles is very easy to essentially spread. It was a disease that we originally thought was pretty much eradicated, but with a lot of the recent changes over the last few years and with a lot of the misinformation that's being guided out there, it's leading to a lot of problems where a lot of these diseases that we thought were no longer around are starting to pop back up. So the reason I bring this up is a lot of people have been asking me lately, should they get the MMR vaccine, which is the mumps, measles, and rubella vaccine? The nice thing about these vaccinations is after you get your initial dose of it, you're typically protected anywhere from 80 to 90% of all these diseases, and it does require typically 2 doses total. Now, for most people, if you do follow the normal vaccination schedule that the CDC has out there, for children, you normally get vaccinated at a very young age, starting as soon as 12 to 15 months of being born. Then there's a secondary dose that follows, and you're typically good for the rest of your life. However, if you are in close contact with any of these people and you have no record of ever getting the MMR vaccination done, they do recommend actually getting a new vaccination completed. Most of the time, it's typically for people that are in high school that are heading into college. That's normally one that they'll verify just to make sure. And they do typically recommend the 2 doses, normally split by about 28 days. So you're talking about a month in between them. For adults, most of the time they only actually recommend 1 vaccination. So the first time that you get it completed, you're typically good to go and you are protected again. The only time that they would ever recommend 2 doses of it is when you are a healthcare professional or you are in close contact. So say you're a teacher or someone that's going to be in close contact with anyone with the possibility of having measles. These are the patients that they recommend that get 2 vaccinations just to make sure that they're protected. So these are the types of things that most insurances will actually cover. I have had a few patients come in and they were covered by their insurance at 0 copay, which is amazing. So if that is the case and you're not sure, we highly recommend heading over to your local pharmacy. Track down your medical records if you can, but if for some reason you can't, you can always double check with your physician's offices. They may have a record for you, but worst case scenario, if you have no way of finding out by any means, it is recommended to get that vaccination completed at least once just to make sure that you have some form of immunity against it. The reason it's so important, and the other thing to keep in mind is, like I said, the first vaccination for children doesn't occur until at least 12 months. That means anyone that's a newborn is at a very high risk of possibly contracting it, which can lead to a lot of serious issues. The biggest one being a form of what they call encephalopathy. Essentially, it's a portion of your brain starts to get larger and swells up with fluid, which could potentially lead to fatal hospitalization or even death. So to be on the safe side, we do recommend everyone getting that completed. Even if you're a strong promoter against vaccinations, there's not enough evidence out there to support that vaccinations cause any serious harm. So we do recommend here, at least with this show, that you do and get all of your vaccinations completed. If you're ever unsure, please talk to your physician, talk to your pharmacies, and definitely you can check cdc.gov. They do have an entire schedule that's available for anybody to do. So talking about our main segment for today's episode, we're looking a little bit more at breathing. The reason that we're bringing this up is it is nicer outside with some of the summertime weather, but even during wintertime it can occur. So things like asthma and COPD are very chronic and they're very easily essentially manageable. You're able to kind of keep them under control. So to help me kind of talk about that today, I actually have a 4th-year student from Neomed and his name is Aaron. Hey, Aaron.
Hi, how are you doing?
Good. So I know a lot of people have always come in and they've always asked me questions about, asthma and COPD and what's the difference. So to kind of help us break this down a little bit, can you tell me a little bit what is asthma exactly?
Yeah, so asthma is a chronic airway disease. and it's generally characterized by shortness of breath, wheezing, some cough, and even some chest tightness. And all of these symptoms generally come across from a swelling or inflammation in the chest due to exposure to triggers. Now, each person has different triggers, so some common ones are like pollen or cigarette smoke, maybe dust mites that you might find in your sheets or in your clothing, exercise, and even cold weather. And so really just avoidance of these is the best thing for it.
Okay.
Asthma affects about 8% of the individuals in the US. It affects more females than males, and it can affect both adults and children. So anywhere in your lifespan, you can be affected with asthma.
Gotcha. So, yeah, ultimately with asthma, I mean, it's a serious issue because it's causing a lot of problems across the spectrum when we're talking about age differences. So, perfect. So, kind of talking about COPD, because some people don't know really the difference between the two. So, can you tell me a little bit about what COPD is or what it stands for?
Yeah, so COPD, or chronic obstructive pulmonary disease, is another chronic disease, and it's actually progressive, so it gets worse as time goes on. It's characterized by your lungs being exposed to some sort of noxious gas. Most commonly in the US, it's cigarette smoke. And this actually damages the tissues in the lungs, causing them to be more rigid, and it actually causes patients to have a harder time exhaling and getting all that air out. So it leads to problems with overinflation of the lungs, and you kind of see like an increased mucus production.
Okay. And the other thing about COPD that sometimes comes up too is that more often than not, it's about 80% of people are affected in the same regards where you have that kind of, it's been caused from some kind of noxious gas. So when you're bringing up cigarette smoke, that's very common. But there are small cases, there's about 20% of all cases where it's actually not linked to anything in particular. So I always want people to be aware that sometimes if you do get diagnosed with COPD, but you've never been exposed to any of that stuff, whether it be smoke or noxious chemicals or anything like that, they still can develop it, but it's very rare form whenever that becomes the case. So.
Okay.
So one of the things is, what are some like differences that you notice between like asthma and COPD to kind of help pinpoint which one?
Okay, so more commonly than not, COPD is something that you would diagnose in your adulthood, so anytime after maybe like 40 years of age, whereas like I said before, asthma can affect just about anybody. And then again, there's that problem with the exhaling in people with COPD. So a lot of times they have these overinflated lungs that can show up on a chest x-ray. And you can actually sometimes see in patients what's called barrel chesting. So the top of your chest gets a little bit bigger because you're holding all this extra air inside your chest. So yeah.
So kind of looking at it right now, we have a couple images that I was able to find here for you guys. So if you look at the first image that we have here, it does show kind of like the difference is in regards to the way that your lungs are going to look when you have asthma. So when you're looking at it right now with asthma, you have kind of this constriction occur. So a normal person's lungs will have like this openness to their lungs that can get the air in there. But with asthma, you can notice this constriction where it looks like it's more jumbled up. And the best way I ever compare it is if you think of a water hose and if you start putting pressure on that water hose and grabbing it at different points, you start to notice that the amount of water that's normally coming out starts to slow down significantly. So we always have to be real careful with that. Looking at the second image, it kind of shows you a little bit about what the COPD is showing you. So if you notice, your lungs kind of look almost like little grape sacs is the best way that they describe it. So if you think they're little pockets where you're able to pull in the air and it gets more narrow and narrow. If you look at the other image that's here, the COPD patient that's there actually has this breakdown where they're actually not grapes anymore. It almost looks like a giant mess where if you had like a toddler come in and just start throwing everything around, it essentially destroys everything. So this is what leads to a lot of issues where your body's not able to maintain the amount of air that it's supposed to. And you'll notice that at the top there's some of this mucus that starts to form and it makes it a little bit harder. So it almost makes it like sticky on the inside so that your body's not able to pull in the right amount of air. So just to kind of give you guys a little bit more of a visual representation of that. Now, with something like this, the biggest thing that we always run into is what are some problems if we just let these diseases just go rampant on their own and not do anything to help manage them?
Yeah, so one of the big problems with that is the fact that these patients are at higher risk of upper respiratory tract infections like pneumonia or even just like the seasonal flu. So letting these things go unchecked, you kind of run more of a risk of these infections, which can lead to hospitalization and extra costs that you didn't really need to incur, and that damage to your body then through the diseases.
Okay. Yeah. So we kind of want to make sure everybody's protected as much as possible then. So kind of looking at it right now, if somebody was concerned or if they started noticing some unusual breathing, what are some things that maybe their physician can do that could help kind of pinpoint what's going on with their lungs?
Okay. So the main kind of test that you do in a physician's office when you're worried about breathing problems is something called spirometry. It's a process that can take up to an hour, maybe even more sometimes, but what it is essentially they hook you up to a machine and they ask you to take as big of a breath as you can and then force it out of you. So at first they ask you to blow as hard and as fast as you can and then just continue that breath until you're completely out of air. And then they take that data that they gather and compare it to what they consider as normal for someone of your age, height, race, and gender. And that's how they kind of can tell if you do have a problem with your breathing.
Okay. So yeah, it's one of the main tests that they'll normally use just to see lung function in general and then kind of go from there. So perfect. Now, a lot of the times, especially on this show, what we're trying to do is we want to make sure that people are aware on both medications and ways to kind of help without requiring medications. So what are some things that people could do that may not necessarily require them to get a prescription or medications that could help these patients out with either asthma or COPD?
So as mentioned before, there are triggers for both of these diseases actually, and one of the biggest things for the management of these is to avoid the triggers. So if you're triggered by cigarette smoking, either not hanging out with people who are smoking, or if you smoke yourself, stopping smoking, as well as just washing your sheets to get rid of those dust mites. If the pollen count's really high, you can stay indoors. And if it's exercise, maybe just a light to moderate exercise or something to kind of keep that in check while you're working out.
Perfect. The other thing that we're always looking at too sometimes is with a lot of these patients, those triggers are probably the biggest thing. So even not necessarily like being the person that smokes, but like especially with like COPD, you have a lot of that thick mucus production. So they always say, make sure you're drinking plenty of water to help to get kind of loosen that up. And the other thing is to avoid people that may be smoking or are known to. So I always say if you can keep covered, using masks, things like that, that help out. And one of the other things, especially when you're talking COPD, because we did say that it was normally a lot of those noxious gases that cause problems. Essentially, if you work in a hazardous environment, make sure everything is up to code there, so that way you're not risking yourself at the possibility of being exposed and causing these further problems, so you don't have to worry about more health complications that could potentially come from that. So kind of looking at the medications, because there are a few different things that classes of medicines that we even use and dispense. What are some things that people could use that could ultimately help them with that?
Yeah, so there's inhalers and there's tablets, for lack of a better word, or pills. And they work differently, but towards the same goal. So some of the pills that you have are things like Singulair, which is brand name for Montelukast. It's a leukotriene receptor antagonist. So the leukotrienes in your body are these molecules that kind of are linked to the inflammation and the muscle contraction in your airways. So blocking that kind of helps to relax the airways, helps your breathing. And then you also have steroids that you can take, like prednisone or methylprednisolone, and these will relax the muscles and reduce that inflammation to assist with the breathing. Aside from the oral tablets, you have inhalers. There's a few different classes of inhalers too. So you have things like a short-acting or a rescue inhaler. These are things like ProAir or Ventolin, and they're both albuterol inhalers. They're good for rapid response, so if you're having an exacerbation or an asthma attack, you can use one of these and it'll help you get out of that, but it won't last very long. So you also have these long-acting inhalers, so you've got a few different classes of these too, because there are just tons of options here with breathing in general. You have inhaled steroids, so you have things like Flovent or fluticasone. You also have Qvar or beclomethasone. And these help to reduce that inflammation throughout the day so that you might not need that short-acting. You also have a couple other long-acting options, including like things with combinations of corticosteroids and long-acting beta agonists, which reduce the inflammation throughout the day. You also have anticholinergics, which again, hopefully reducing the need for your rescue inhaler and help you breathe throughout the day so you can live that healthy, happy lifestyle that you want to ultimately.
Yeah, so kind of hitting on that, the biggest thing is that, especially with the inhalers, that's probably one of the hardest things, is some of them do function a little different from each other. Some of them you are essentially puffers. That's probably the most common term that I've ever heard of anybody call that. But the main thing is a lot of them function where some of them you do push down. Some of them don't require that though. So it's one of those things that anytime that you ever get started on a new inhaler, or if it's something that you're not familiar with, or it's a first time use, we always recommend talking to either the pharmacist or your physician that diagnosed it and gave you that, to kind of explain it. It does take a little bit of time to get used to them, but the biggest thing is there's so many different types and models now that exist that some of them make it easier and some of them make it harder. One of the other things too is the spacer chambers. Can you talk a little bit about what those are exactly?
Yeah, so with the different kinds of inhalers, there are some that use what's called like a propellant, and that when you actually activate them or use them, the inhalers will just, like the short-acting inhalers come to mind, the ProAirs and the Ventolins, it shoots the medication with so much force into your mouth that a lot of times it just gets lodged in the back of your throat. These spacers are things that you can attach to these kind of inhalers to give your body the chance to actually inhale the medication, so you don't have to have that coordination of pressing and inhaling as you need. You can just use this inhaler as a sort of tool to help you better get all the medication. That way your symptoms actually go away.
Perfect. And then the one other thing that I was kind of wondering about too, if you can explain it, is with some of the medications, and especially like the medications you explained that had like the steroids in the inhalers, they actually recommend always rinsing out your mouth. Is there any particular reason for that?
Yeah, so with the steroids, as you use those, if you don't rinse your mouth out, you have the potential for an infection called thrush, which you get these like white plaques in the back of your mouth. Ultimately, it's easily preventable, so yeah, they say just swish it around and spit that out, so that way you don't have that steroid just sitting in the back of your throat.
Okay. And I think that pretty much covers all the medications there, yeah. So kind of talking about it a little bit, one of the things that we always like to mention to everybody here on the show too is there are certain medications, because a lot of people have access to a lot of the over-the-counters and other remedies that they can use. Are there any particular types of medicines that these people should avoid that could make it worse or have any serious problems?
Yeah, so a few things come to mind. First, talking about triggers again, things like aspirin or NSAIDs like ibuprofen or naproxen over the counter, Advil or Aleve, can actually function as a trigger, making your asthma or COPD a little bit worse. So trying to avoid those things, and if you do need something for pain, you can switch to something like a Tylenol over the counter. Secondly, to avoid is something like a cough suppressant, because with COPD and all that extra mucus, you actually want that to go somewhere. You don't want that sitting around in your chest, and your cough is helping to get that out. So if you suppress the cough, then you don't really have a way of getting all that mucus that's sitting in your chest out.
Yeah. The main thing is, like, whenever we have people that come in that are feeling sick or anything, we don't necessarily deny them the cough suppressants, because ultimately we want them to feel better. We want them to get, a restful night's sleep is the biggest thing. So most of the time we do recommend against those. So the most common one's probably going to be something like Delsum or anything that has the dextromethorphan ingredient. That's probably the biggest thing. But on occasion, those do they are useful just to kind of help, just to that somebody can actually, sleep or get over their cold. And then once they get over it, then we normally recommend against it. Certain products do exist, like Mucinex. That's the other big one. Mucinex does kind of help, if it's the regular Mucinex, to get some of that extra mucus out. So if it is a really tough bout and their chest feels really tight for whatever reason, they can sometimes use that to get that extra little bit out too. So. The one last thing is, typically we kind of have some of our patients that go through what they call asthma action care plans, I guess is the biggest thing. Can you kind of touch on it a little bit as to what that might entail, just to kind of help out some of these patients, especially like younger kids?
Yeah, so the asthma action care plan or the asthma action plans are actually something that they come up with their physician to kind of help see where they should be on a day-to-day basis. So patients often with asthma will get something called a peak flow meter, which is like a device that you can breathe into, and it gives you a number to put with how well you're breathing, so that way you have some sort of visual way to measure that. Based on that measurement, you would either use your inhaler, your rescue inhaler, this many times, or seek more help. So if your number is low, you can use the rescue inhaler and then recheck it. And if it's still low, then maybe it's time to follow up with your physician and say, hey, maybe we need to adjust my maintenance medications so that way I'm not running into this problem anymore.
Yeah, and it's just a good like stepwise process for anybody, including like maybe parents who are unfamiliar on what to do in these situations. It gives you kind of that step-by-step manual or guide to kind of follow too. So, well, perfect. Well, thank you so much for all your time today, Aaron. It's been really good to learn a little bit about the asthma and COPD right now. So at this point, I always like to say, if there's any questions, comments, concerns that you ever have, by all means, please double check with your physicians, check with your healthcare professionals, your pharmacists, even nurses, just to kind of see, if you are unsure about anything that we talked about, or if you think yourself you may have something like this, it's not a bad idea to get them to check it out just to be on the safe side. But until next time, thank you guys for your time, and we'll see you on the next episode.